Good afternoon or good evening or good morning to everyone who's joined today's webinar, No Veteran Amputee Alone, supporting military veterans and their families throughout the limb loss, limb difference journey. I am delighted to share this opportunity to highlight the Amputee Coalition's partnership with the VA's Amputation System of Care. We'll highlight the Amputee Coalition's partnership and the VA resources that are available, in addition to programs and services for veterans with limb loss and limb difference, and the veteran caregivers and their families throughout the VA's Amputation System of Care. Attendees today can ask questions during this webinar to engage in meaningful conversations relating to veterans' needs. Please use the Q&A tab to enter your questions. And this recorded webinar will be available by this Friday, November the 26th. And I am delighted to introduce Patty Young, who is our main point of contact to support our partnership with the VA's Amputation System of Care. She is a certified prosthetist and a master specialist in physical therapy, and she oversees the VA's Amputation System of Care as the National Program Manager. Thank you so much, Patty.
Hi, thanks for having me. I'm excited to be a part of today's presentation, and I do appreciate the partnership the Amputation System of Care has with the Amputee Coalition. So we're very excited to be able to partner with them. So I'm going to bring up my slides here. I think everyone can see this. So again, as Nicole said, I'm Patty Young. As far as disclosures, I have no relevant financial disclosures, and the views that I will express today are those of my own and not of the federal government. So my first slide here is just to kind of give everyone an idea a little bit about how vast the Amputation System of Care is. We are a national program recognized by the VA Central Office. We have 7 sites that are referred to as regional amputation centers. And those centers are signified by the red dots on the photo. Our polytrauma amputation network sites, there are 18 of those, and they are scattered across the country as well, and they are represented by a blue dot. And then all of the other sites across the country that are sites where there is a VA or a VA clinic with an amputation care team are represented in gray dots. I will say that there's always new ones popping up. And so I can't say that this is totally accurate all the time, because we do have a lot of new teams coming about. So this is as frequent or as recent, sorry, as probably July. So for right now, this is a pretty good representation of what we have. Just so everyone understands, a regional amputation center is a center where there is a dedicated team to provision of amputation care. The members of this team include a medical director for the RAC site, an amputation rehab coordinator, which is someone who is typically a physical therapist, occupational therapist, or certified prosthetist, a program assistant to help manage the team, maintain contact with veterans, keep data, and then a regional O&P specialist. So there are 7 regional O&P specialists across the country. As far as the PAN sites also have a dedicated team. They have a medical director for that site. They have an amputation rehab coordinator, and then a program support assistant. And then, of course, at the ACT sites, the things that sets aside the RAC and PANS teams from a typical amputation care team or ACT site is that the team at the ACT site is a team that is treating all populations and sort of being clinically involved and engaged 100% of their time. So they tend to be a team that doesn't have as frequent an amputation clinic as other sites. So with that being said, it sort of brings me into our hallmarks of care. So the Amputation System of Care is in fact an integrated national healthcare delivery system. The beauty of the VA is that we get to reach all ends of the country. We are in areas such as Guam, and we are all the way out in Hawaii and Puerto Rico, and we try to reach our veterans as far as we can. We pride ourselves in the interdisciplinary team approach that we have. As you could see in the slide before, it's a physician, a prosthetist, a physical therapist. Those are not the only 3 people as part of the team. We work very closely with podiatry, surgery, nurse managers, social workers, and everything in between, primary care physicians. So we pride ourselves on our interdisciplinary team approach. What we try to make sure of is that we are providing that care throughout the lifetime of the veteran. So that is one of our big hallmarks as well, is our care coordination. We are passionate about being involved in and being cutting edge with all of our technological advancements that are out there, our education, our training of our employees as well as our veterans, and just in general looking at an integrated and collaborative approach to care. So a little snapshot of the VA amputation system of care. So we're in our 10th or 11th year really in existence. We published an article on our 10 years of outcomes based on all that we had done up until 2020. At this time, we look at, we have about 97,000, almost 98,000 veterans living with limb loss. And 45,000 of those veterans are categorized as those living with major limb loss, meaning above the elbow and above the ankle. And that was what we saw in fiscal year 21. So our fiscal year starts in October and ends in September. So this data is pretty recent. And then 1.8 million veterans are currently at risk for amputation. A better part of our population of veterans living with limb loss is in fact those who have lost their limbs to disease process. So, and then in the bottom in blue is most important is our mission is that is to enhance the quality and consistency of amputation care through providing the specialized expertise that our population will receive from our outstanding centers of excellence, incorporating the latest practices in rehab, therapy services, and prosthetic technology. So a little bit about the OEF, OAF, OND population. So this is the post 9/11 veterans. Oftentimes people are under the assumption that there have been many veterans, many more than 1,729 service members who have lost limbs to a conflict-related experience. That is a low number. Most say they didn't think it was that few. One is one too many. But that being said, we have the pleasure of treating and caring for these veterans. 73% of those were to an IED blast. The average age is about 37. And we have a very high percentage of those. As you can see, 92% have actually transitioned their care to the VA, and we're very grateful for that. We're grateful for the opportunity to work with this individual. 30% of that population is actually multi-limb, which sort of lends to why we excel at providing care to these veterans, because we as a VA are accustomed to seeing that triage of care. We are well versed in providing care to the veteran with single limb loss, but also to those with multiple limb loss. And again, as I said before, our care starts from the moment limb loss occurs and goes through their lifetime. So we address everything from DME needs, equipment needs in any way, shape, or form, and prosthetic needs. We have a strong focus on women veterans right now. Women comprise only really 3% of the veteran population. And although that seems like a small number, this has always been something that I'm passionate about. I feel like women have not been as well represented in the VA only because it's a growing population. So we in the VA have really put set our sights on connecting with that population. So one of our big efforts here is to provide that individualized patient care approach. Women have a different view of themselves, of their body image, of what they're looking for in a prosthetic limb, of how a prosthetic limb might fit. And we want to make sure that we're providing that specialized, customized approach to their care. So we are doing a lot more to include gender-specific factors. Another thing that we're doing is we're incorporating the concerns of the female veteran by seeking out the information. We're sort of in an info gathering stage right now where we're reaching out to those veterans and really trying to connect with them to hear what they have to say and to learn about their experience. And then something kind of interesting, in 2019, I believe it was, the GAO came through the VA and came to a few of our sites, our centers, our RAC centers, our regional amputation centers, and interviewed many of our female veterans. And in the end, they actually found that there was a large population of women veterans who expressed great satisfaction with the care they received as it pertained to their amputation and their prosthetic options. The good thing that came of that, there are many good things that came of it, but one of my favorite parts of that GAO experience was that we got to hear from veterans, from female veterans, as to what their concerns are and where their interests lie and how to improve the world of prosthetic care and limb loss. So we were lucky to have had that. I know a lot of people would look at a GAO investigation as a negative thing, but for us, it was a really positive experience because we got to learn about more of what's out there and more of what's needed and then respond to that. So something that Amputation System of Care has always done well is our virtual amputation care. So as you can imagine, and if you can remember that very busy slide that I first showed with all the dots on it, you can imagine that there are clinics across the country as there are veterans all over the country. Some of our veterans live in very rural areas. And a certain area that kind of comes to mind for me is the area of like Idaho, Montana, Wyoming, Dakotas, that area where the VA hospitals are fewer and far between. With that being said, the Amputation System of Care really embraced virtual care way back in 2011. I know it sounds crazy because now it's just a way of life for all of us, given this pandemic situation. We're also used to having virtual care options all the time, but we were actually providing virtual care options way back in 2011. What we wanted to do is really the intent at that time was to embrace the technology to allow us better access to our veterans. So a lot of our veterans were so rural that it was going to take them several hours to get to a local VA. So what we started doing was connecting them with a smaller CBOC. CBOC is a community-based outpatient clinic. As you can all imagine, we do a lot of acronyms in the VA. So the CBOC, so they were traveling to the CBOC, which was typically a closer distance than the VA itself. And we would beam into the CBOC and they would be on one end with an employee of the VA, and teams from the RAC and PAN sites would be on the other end where the VA was. The beauty of this was that veterans felt like they could connect and didn't have to drive the distance, didn't have to spend the time and the money trying to get to those locations. The nice part about it for us, I would say, is that not only did we get access to our veterans and we were able to maintain a closer line of communication, but it also allowed us to prepare really for the pandemic. Not that that was what we were aiming for in 2011, but we've really sort of been one of those lead teams within the VA system that has embraced this so early on that we've been able to embrace all of the other new developments through the years. So obviously, as you can all imagine, there was an expansion to the home then. In 2017, the VA created something called VA Video Connect, or VVC. It was an opportunity, it was a virtual platform that allowed the teams an opportunity to beam into the veteran's home or their community location. So an example of this is we had a veteran who was combat injured post 9/11. He has a wife and 2 children, and his wife was a nurse, but she worked per diem. And he was supposed to come into our clinic on a Wednesday. And he called me that morning and apologized because he had to cancel. He told me that his wife had been called into the hospital and that he had to stay home with the kids. And his kids were 2 kids under the age of 3. So he explained to me that the drive, the hour and 25-minute drive, unloading them from the car, bringing them into the VA, being there for their appointment, loading them back into the car was going to be a lot for him to do alone, especially since it was during nap time. So he was especially concerned about how the children would respond. So the beauty of this is we said to him, not to worry, why don't we just do this and we can beam into your house? And his response was hysterical. He was like, "Are you serious, Patty? This is awesome. Yeah, I'll totally do that." So it was exciting to watch him. He was adaptable. He's easygoing about it. He was totally game for the experience. So he put his kids down for their nap, sorry. And then we beamed into his house. And the whole time during the session, he couldn't stop thanking us for this. He kept telling us about how much of a pain in the butt it was going to be for him and how exhausting it was going to be for him and the kids. And after that, we've actually done quite a bit of virtual visiting with him since that time. One of our other big tenets within the amputation system of care is our annual contact. We feel strongly about visiting with our veterans on an annual basis. The beauty of virtual care is that it allows us to do that, and it takes the stress off of the veteran. These annual contacts, it's not always for a reason other than just for us to be able to see the veteran and talk with the veteran and check to make sure everything's okay. So it doesn't always precipitate a reason to come into the clinic. But with virtual care, we can set up an appointment and we do something of an annual contact. It's almost like a wellness check as well. We ask them how things are going, how their DME is, how their limb is fitting, and just kind of catch up with them and see how they're doing. So it's given us a great opportunity to connect with our veterans during the pandemic, just kind of to make sure that everyone's doing okay. And I know that many have expressed a feeling of connectedness, especially with the pandemic and all of the isolation that was going on with that. Another thing is we're heavily involved in virtual adaptive fitness programs, and we push that for our veterans. So something within the VA and their adaptive sports and fitness program has done an outstanding job of moving to a virtual platform as well. Something that we engaged our veterans in and encouraged our veterans to become engaged in is there was an adaptive CrossFit session that happened in, I think it was January or February of last year. So the VA Adaptive Sports and Fitness Program put together this session. It was it was 4 consecutive weeks with a new exercise program each of those weeks. And then veterans were able to connect over that platform. They were able to swap ideas, tell people their experiences, just kind of for the camaraderie, but also for a little bit of that competitive nature too. So it was a great success, and they're actually planning to do it again in January of 22. And then another thing that we have out there now is our MyVA Images. It's a new program where it's almost like a secure text messaging chain. So the clinician can initiate communication with the veteran by way of a link, and that link is received within an email by the veteran, and it requests the veteran to provide either a video or a photograph to the clinical team. So the veteran comes with instructions. It might ask the veteran to make sure that they can, the clinician will be able to see the video clearly. So make sure that there's proper lighting and make sure that the team can see you walk away from or toward the camera or something like that. But it allows the team to do a check-in and not take up an entire slot for a clinic when the veteran doesn't want to have to schlep in and schlep back out, or even stop what they're doing. They can do this at the time that works best for them. Maybe it's at the end of their workday. Maybe it's when the family member comes to visit and they can have someone to be their camera crew. But it's a really great tool. So we've been engaging in using the MyVA Images as well. So some of our goals for the future looking at virtual amputation care is that we really feel strongly about making sure that we continue the great care that we can provide to our veteran by way of either virtual or in person. We want to make sure that it's comfortable and convenient for the veteran, and that they still feel that sense of connection. Something that we're also looking into, and it's kind of a big buzzword these days, is outcomes. So we're looking to do as much as we can to track some of those outcomes. A lot of the outcomes that we are typically used to gathering, that data comes from outcomes tests and measures that we do with veterans in person. So we're hoping to explore a little bit more with tracking those outcomes in a way that could be virtual. So things wearables such as your GPS tracker or your Fitbit or your Apple iPhone or Apple Watch or anything like that. So we're looking into ways in which we can do that specific to that. And then just in general, also looking at from an enhancement of all of the technology that's out there. We're also looking at various ways in which we can connect with prosthetic componentry as well to track some of those things and to be able to make changes if it's possible to those devices. There's a lot right now with hearing aids, and I think we all learn a lot from the hearing aid and the audiology and hearing impaired world. There's a lot of modification and changing, modification to the programs for hearing aids. So that's something that we're learning from as well. If they're able to tap into someone's hearing aids and modify the settings, is this something that we could possibly do with prosthetics? So this is all the stuff that's being discussed at the moment, but just to kind of give you an idea of, we never just sit back. We're always thinking about the next obstacle and the next challenge. And so just to kind of give you an idea of what our virtual amputation visits have been from the beginning, I did not put in our earlier stages of telehealth because the numbers weren't all that impressive as far as what they are as compared to what they are now. But in FY18, and I'm sorry that the numbers just did not line up properly, but there were only 35 visits to the vendor. So that's something that the VA has really put forth effort. Our amputation system of care teams will actually beam into a community prosthetic provider. So if there are veterans out there, and there are many, and we're thankful for our community prosthetic providers, but there are many of our veterans who aren't able to go to the VA. It's just not convenient. It's too much travel. And so they work with a community prosthetic provider. And we are very fortunate to partner with many of these companies. What we've started doing is we've started beaming into their office. If the veteran is going to go to the office to see their prosthetist and it's closer to their home, which typically it is, it's closer to their home, we're able to beam in as a team in the VA into the prosthetic provider's office. So that's what's on that bottom, that lowest line or that darkest line. So in 18, we had 35 of those visits happen across the country. In 19, it increased to 140, which is pretty impressive in 1 year. And this is pre-pandemic, remember. In FY20, when the pandemic hit, which was halfway through our fiscal year in the VA, we saw 321, which is again outstanding. And then, which then went up even more to 748 in FY21. And I do believe that this is going to continue to climb because now that people know that this is an option and the communication is there between the community prosthetic provider and the amputation care team and the veteran, it's a nice way to connect all at once during one visit versus having to create even more visits for that prosthetic wearer. To home is the orange line that kind of starts slow and then has a huge climb. And that's obviously, as you can all imagine, happened during the pandemic. Went from 375 in 19 to 3,976 in FY20. So again, like I said, there's something about the amputation system of care teams where we don't want to let our veterans go. We don't want our veterans to feel like we're not, attending to their needs and connecting and communicating. So we definitely saw a lot of our veterans virtually and made it work. And then 1,000 more, almost 1,000 more in FY21 in comparison to FY20. And then our to VA centers, that's the yellow line, the one that's kind of has gone down a little bit. But FY18 and before that is what I was referring to earlier when I was telling you about how, when I mentioned that we were as teams beaming into center-based or community-based outpatient centers. And that's gone down because again, veterans haven't been going, leaving their home. They've been, playing it safe with the pandemic, which is great. But so we've maintained it, but it hasn't climbed. So just in general, some of our programs, we like to talk about a lot of the programs that we do within the VA, because it's not just a community or a program based on clinics alone. We have a lot of great things to offer our veterans. We're heavily involved in research, various opportunities in research across the country. We have something called our Upper Extremity Amputation Center of Expertise that's located in the Bronx. They're a center that has an additional prosthetist who specializes in upper extremity prosthetics, an occupational therapist who specializes in training individuals with upper extremity prosthetics, and a physician who focuses on this as well. This team tends to be something of a consultative team at times, and using that virtual platform, it's the perfect way for that team in the Bronx to connect with teams across the country where they may have some questions. Maybe they've overlooked something, maybe they just sort of need to talk it out, and that's what that team does. They will bring veterans to the Bronx for experimental research type stuff. They'll also bring them in if a veteran is not able to find success in their area and their community. We will certainly help to get them to the Bronx, to this center of expertise. So that's a great team and a great resource for our veterans. Our peer support programs, as many of you already know, the Amputation Coalition, or the Amputee Coalition, is our partner in this, as it is to many other healthcare systems. We have a robust peer support program. We have an established contract with the Amputee Coalition, and we work closely to maintain our peer certification training for our amputation rehab coordinators. So we definitely are active with our certified peer visitors, who are one-on-one contacts, as well as many of our sites have support programs that are actually also registered within the Amputee Coalition's website. And then finally, our boot camp program. I put it at the top of the list, but I talk about it last because it's a little bit more of a boutique situation in many of our sites. So I believe, and this is just off the top of my head, I think it's 22 of the 25 centers have a formal boot camp program. A boot camp program, we call it boot camp because a lot of our veterans say they feel like they're back in boot camp, learning something new. It's when we invite veterans to come into the VA and be with us as an inpatient patient into one of our rehab programs. This is usually for a veteran who is brand new to using a prosthesis. They don't yet know the ins and outs of it. Maybe they're still perfecting supply management. Maybe they're really only wearing their prostheses for short segments of the day. But the boot camp program invites them in and they stay for a set period of time. Some centers have it as few, as little as a week, and some have it as much as a month. But those centers, the experience the veteran has in those centers is that they get an interdisciplinary team approach. So they receive care from a physical therapist, an occupational therapist, their prosthetist is there and ready to go. Physicians, nursing, social work, dietary assistants, mental health assistants, just as they adapt to this new change in their functional status. But it's a great opportunity to watch veterans really embrace their new limb or limbs and learn to really push themselves. So it's really exciting. I included the two pictures on the right because these are during our outings. So one of the things that we do is that we bring our veterans outside of the VA because in the VA, something that they learn is to use their limb. The only problem with that is in the VA, everyone is prepared to step off to the side and to take all obstacles out of their way, and it's a controlled environment, and so it's not really real life the way we would like to see them learn to use their prostheses. So we make sure that when they're in our programs, we provide them as much real life experience as possible. We bring them outside, we bring them to coffee shops, we bring them to the store, we bring them to the park. If someone tells us that their goal is to get back to being on the field with their grandson, watching them play soccer, then we're going to find a park where there's a soccer field, a bit of a distance from the parking lot, to really make sure that we're pushing them a little bit to really achieve a goal, like being outside and being on uneven terrain and dealing with the parking lot and the gravel and the grass. And so we really try to kind of kick it up a notch. But all of them have had a great experience. We've had great experiences across the country. And so this has become one of the hallmarks of the care that we provide. So other things we're working on are publications. As I mentioned before, the 10 years of accomplishments is there. We also have worked with the Department of Defense on the creation of a clinical practice guideline for rehab for the individual with upper limb amputation, and then one for the individual with lower limb amputation. We've also created 2 booklets, one for lower limb rehab and sort of as a support document to veterans and their family members, called The Next Step. And then within reach is the publication we've created. It's a handbook for individuals who are learning to use a prosthesis and living life with limb loss of an upper extremity or an arm. So those 2 are out there for our veterans. I provided the links to everything, so you'll have the opportunity to click on those. And then something that I'm especially excited about is that the Amputation System of Care is collaborating with the Amputee Coalition to create some literature on sex and intimacy for those living with limb loss and limb difference. We know it is a topic that is not discussed, not covered as much, is not information that is really readily available to the population. And so we feel passionately about connecting with people on this. So something that we're doing is we're in the midst of trying to receive IRB support for doing this research, and the Amputee Coalition is doing an outstanding job of spearheading this. And the VA and the Amputee Coalition will then take that data from focus groups that we are hoping will get some volunteers to be a part of. So keep an eye out for that down the road. But we're looking to connect with persons living with limb loss or limb difference, and just finding out what's out there that they want to know more about, what's out there that they're feel comfortable with, or perhaps areas where we can help them help expand some knowledge base. So that's where we are with our collaboration project. So on that, I'm going to finish up the presentation with some questions and discussions.
Thank you so much, Patty. That was a ton of information, and I think we'll have a lot of people wanting to circle back with you to learn a little bit more. So I just wanted to help with one attendee's chat came through with a question about, if you have a product available for amputees, especially women, what NAICS code would the Amputation System of Care be searching for through SAM? And I apologize, I'm not familiar with the acronym.
Okay, so I'm sharing my screen, but if it's okay, I'm going to bring up the chat so I can see. So here we are. I'm going to look for it. Amputees, especially women. So the ASoC, okay, would be searching for through SAM. I don't know. Allison, I'm going to have to get back to you on that. If there's a way I can get in touch with Allison, Nicole, would you be able to help me with that? And then Absolutely. I'll get back to her. Yeah, for sure.
Thank you. And then just a couple questions that we have in support of veterans who contact the Amputee Coalition. These are some of our most frequently asked questions. So maybe some attendees in the chat wanted to ask this as well. But how does a veteran who is living with limb loss or limb difference, who hasn't had any past communication with the VA or is not currently associated with the VA, how do they get started with getting connected with the Amputation System of Care?
This is my favorite question. Thank you. I love this question because I think a lot of people aren't aware that there are these centers of excellence and that there are amputation clinic teams really throughout the country. If you Google Amputation System of Care, we are what pops up. And or if you just, I think even if you Google amputation in the VA, we should pop up. But on the main page of our website is the map that I showed you earlier. And underneath that, there's a PDF attachment. The best thing to do is to find the site that's closest to you and call the contact from that site. Our amputation rehab coordinators who are listed on that document. They are 25 of the best people. They know it all, they can juggle it all, and they can make a connection for a veteran to get to the closest place to them. So even if the site itself that they attend clinic or primary care doctor is in is not listed on there, we can find someone for you. So just find the amputation rehab coordinator who's closest to you and then give them a call and we'll help you out.
Thank you so much. And for the attendees, we'll provide that PDF in our follow-up webinar contact information. The next question is, does the amputation system of care pay for a prosthetic device or other durable medical equipment for the veteran with limb loss?
Yes, to both the prostheses and the durable medical equipment. Yes. Our intent is always to take care of our veterans. As far as the prostheses, as long as it's clinically indicated and safe for the veteran, then yes, we will pay for it. We encourage our veterans to be active and to be involved in various activities. And so if there are activity specific prostheses that they need, we are definitely, happy and excited to get them back to that activity. As far as DME, we do a lot of DME. Our veterans are evaluated, if it's appropriate, are evaluated for wheelchairs, adaptive sports, even just little things like grab bars in the shower chairs, tub transfer benches, all of that can all be addressed while in clinic. And that's the beauty of our interdisciplinary clinic, is that there's someone from every discipline within rehab to really make sure that we cross all of our T's and dot all of our I's. So
that's wonderful. Is that coverage also provided for continued care as far as rehabilitation care?
Yes, definitely. Mm-hmm. Yes, for sure.
Perfect. And does the amputation system of care provide support for veterans who have lost a limb from causes that are not related to war?
Yes, definitely. That's in fact a bigger part of our population. But yes, we most definitely, we see veterans, yes, throughout their lifetime.
And how would you say is that type of care different than war caused the amputation?
Yeah, it's funny. I think it's different in a lot of ways. I think one of the big things is that the education of the veteran and their care provider or their family member, when it comes to those who've lost their limbs to a disease process, tends to be a big highlight of the care we provide. I feel like every team in the VA centers of excellence, those 25 sites, really does a great job of making sure that they're providing the education that goes with it. So now it becomes not just a concern to get them ready for their prostheses, but it also becomes important to focus their effort on saving that intact limb and keeping that limb as their intact limb. So that's a really big part of what we do, is that education and training and connecting them with the right teams, dietary, podiatry, et cetera. So yeah, that's where I think our focus would just change in that sense. So.
Thank you. And the last question is tapping into where we support the peer support programs. Does a veteran with limb loss who's interested in becoming a VA certified peer visitor, how do they get started with getting connected to the program?
Yeah, that's a great question as well. So similar to the answer I had earlier about how to connect with someone, just find the name as close to you as possible. So if you're located in one area and you look on that list on the website, and what's going to be included in the attachments for this presentation, find a name that's closest to you, call that person and talk to them about your interest. What they can do is they can connect you, and they will connect you with someone closest to you, or at least in a way to get you trained and ready to go. There is a lot of milestones or clearance aspects of it that you have to pass as a veteran in our volunteer system. That's a really big thing, is in order to be a volunteer, you have to pass a background check and you have to you know, make sure that you're ready and willing to spend the time doing it too. It does require a time commitment, so that the volunteer services within VA really insists on your availability to do this as well. But yeah, that's not a problem. We are always welcoming our certified peer visitor attendees or those with interest in it. So.
Thank you. And does the certification also support the veteran caregiver? So the families, the parents, the children, if they wanted to become part of a family peer visitation team, does the curriculum for the VA CPVs also support the caregiver?
Yes. We're in the midst of actually revamping it and updating the current curriculum for just the veteran living with limb loss. But something that we've always had is a caregiver support program as well. And that's from way back when in, I think it's 2012, 2013. We are looking, that's going to be our next effort is to update that. So, but yes, we want to support the family members as well. Absolutely.
Perfect, thank you. And I know I'm in a personal circumstance where I've reached out to you specifically on a civilian who is requesting some support just to have a veteran's perspective on some pretty complicated health conditions and some complicated amputations. Is that something that the veterans who are part of becoming a VA certified peer visitor, can they also provide peer support to the civilian community for kind of special circumstances?
Yeah, that's a great question as well. Yes, if they're comfortable with it. So what we offer the veteran is the opportunity to become a certified peer visitor within the VA system, but we also offer them the opportunity to be also at part of the roster of civilian CPVs. So it's up to the veteran themselves, but yes, many of our veterans say yes because they like to give back, and so that's a good thing. Yeah.
Perfect, thank you.
Awesome.
I think that wraps up our questions from the attendees. And if we have any follow-up questions that come through to either the peer support team, we'll be sure to reach out to you so that you can help answer some of the questions if we can't answer them directly.
Yeah, that's awesome. Thank you. Thanks so much. Thanks for the opportunity to be a part of this today.
You're welcome. And then I think on the next slide, we wanted to make sure that we sent some contact information. So Patty, if you could go to the next slide.
I think I ran out of slides.
That is no problem.
Okay.
So there is a website that we'll send in the webinar follow-up that has the web address for the contact for the Amputation System of Care. We also, in Amputee Coalition's Community Connections, which is our searchable database, making sure that we host veteran support groups and list them in the searchable database for local, state, and national resources to be listed. The great thing with Community Connections is that we have the ability to do search tags. So our veteran support groups are all in Community Connections right now with the appropriate search tags. We are hoping to move more veteran-specific resources into Community Connections. So if those of you in the chat have some resources that can benefit our veteran population or our active military population and their families, please reach out to the partners email at amputee-coalition.org so that we can work with our resource center team to make sure that we're adding specialized resources for the veteran and military populations. But again, anytime that you would like to connect with the VA or the Amputation System of Care or have some questions for Patty after this webinar, please email peersupport@amputee-coalition.org. And here's the website directly for the VA's Amputation System of Care. It's www.rehab.va.gov/ASoC/. And if you'd like to connect with the Amputee Coalition directly as a veteran with limb loss, limb difference, or a caregiver needing support or resources, you can call our 800 number at 888-267-5669. There's also on our main page of our website, there is a button to click for Ask an Information and Referral Specialist form. If you click on that and enter your information, you can ask specific questions that our Resource Center team can circle to the various departments within the Amputee Coalition. And then if you have a question relating to veteran support, wanting to become a VA certified peer visitor, or simply want to get connected with a veteran support group, please email peersupport@amputee-coalition.org.